Hi all, welcome to Physio Exam Buddy. In today's video, we are going to discuss the movements of small intestine. This is a frequently asked short question in physiology. So let's quickly cover the important movements and their functions in an exam focused way. We can classify the movements of small intestine in three phases. That is movements happening in the interdigestive period and the movements which is related to meals and certain motility reflexes are also included in the movements of small intestine. In the interdigestive period, we will get the migratory motor complex and during meals, there are mixing movements, propulsive movements and certain movements of the villi. Mixing movements include segmentation movements, pendular movements and tonic movements, whereas propulsive movements include peristalsis and the movements of villi. So these three are the main movements related to the meals. And finally, the motility reflexes. First, about the movement occurring in the interdigestive period, that is in between the meals. The main movement is the migratory motor complex, which is also known as migrating myoelectric complex. And they occur during the fasting or interdigestive period, that is in between the meals. And it includes mainly cycles of both electrical activity as well as motor activity, starting from the stomach to terminal ileum. And this movement is not at all continuous. It occurs at an intervals of 90 minutes and they migrate at a rate of 5 centimeter per minute aborally. And the migratory motor complex include three phases. That is phase 1, which is the quiescent period or there is no spike potential or contraction happening. Whereas the phase 2 include irregular spike potentials as well as contraction. And the phase 3, which include burst of regular spike potential as well as contraction. Next, we are going to the movements related to the meals. First one is mixing movement and out of this, the first one is the segmentation contraction. You can see here rhythmic ring-like contractions which occurring at regular intervals. That is alternate state of contraction as well as relaxation like a chain of sausages. And this helps the chyme to move in both the directions. So please keep in mind that here the chyme moves in both directions. And the mechanism, it is mainly initiated by a focal increase of calcium superimposed on our basic electrical rhythm in our GIT. And the main function of this segmentation contraction is that it will slow down the transit time and it will increase the contact time, which favors the chopping as well as mixing of the chyme. And this occurs at a rate of 12 per minute. Next movement is pendular type of movement. That is the movement similar to a pendulum. It includes up and down or forward and backward movements, which also helps in the mixing of the food. Next movement coming under mixing is the tonic contractions, which are prolonged contractions that isolates one segment of the intestine from the other segment, which helps in the increase in the contact time. And the main hormones which affects this tonic contraction are first one is either occurs a slow wave amplitude increase because of the hormones like cholecystokinin, motilin as well as insulin, whereas decrease in this contraction can happen because of the hormones like secretin as well as glucagon. Next is the propulsive movements. That is the stretch by the chyme. It will initiate a contraction that is behind the stimulus and produce an area of relaxation in front. And this propulsive movement occur at a rate of 2 to 25 centimeter per second. And the main function of this propulsive movement is it will propel and spreads the chyme. And the mechanism of these propulsive movements are mainly neurally mediated. That is, whenever there occurs a local stretch by the chyme, it will cause a release of the neurotransmitter serotonin, which will activate the sensory neurons present in the myenteric plexus. And this activated neuron, it will secrete the substance P as well as the acetylcholine retrogradely, and it will produce the constriction behind. And anterogradely, the activated neurons will secrete nitric oxide as well as vasoactive intestinal peptide, which is responsible for the relaxation in the anterograde direction. So in the retrograde direction, it is contraction by substance P and acetylcholine, whereas in the anterograde direction, it is relaxation by nitric oxide as well as vasoactive intestinal peptide. And the main hormones which causes an increase in the peristalsis is gastrin, cholecystokinin, motilin, insulin and serotonin, whereas decreased peristalsis it is due to secretin as well as glucagon. Next is about the law of intestine, also known as the law of gut. That is the chyme. It is propelled only from the oral to caudal direction. That is the law of intestine. That is, if a segment of the intestine is resected and resutured, there is no effect. That is, the chyme will be propelled only from oral to caudal direction. But if it is sutured in the reverse position, the intestinal propulsion will stop. So the reason for this is that the meandric plexus is polarized only from oral to caudal direction, and this is responsible for the one-way transmission or the polarization. And the descending rate of rhythmicity of the basic electrical rhythm is from the duodenum towards ileum. That is, the rate will decrease from 12 per minute to, in the ileum it reaches to a rate of 8 per minute. Next is about the peristaltic rush. It is just intense peristalsis which happens during diarrhea as well as intestinal obstruction. And this peristaltic rush movement, it will sweep all the contents of the small intestine and relieve the small intestine from any irritant chyme in the intestine. Next is the movement of villi. That is mainly swaying type of movements because of the shortening as well as lengthening movements of the villi by villikinin, chyme as well as vagal stimulation. These are the three stimulants for the movement of the villi. And this movement mainly helps in the absorption as well as helps in the emptying of the lymph from the central lacteals. Next is about the motility reflexes in the small intestine. There are mainly two reflexes operating in the small intestine. First one is intestinal reflex as well as the gastroileal reflex. First about the intestinal reflex. That is, when a part of the intestine is distended, what happens is that the rest of the intestine will relax, which helps in the forward propulsion of the chyme through the intestine, and it is mediated again by local meandric as well as long vagovagal reflex. Next is about the gastroileal reflex. That is, when the food leaves from the stomach, the cecum relaxes and the ileum contracts. That is, the passage of the chyme through the ileocecal valve will increase, and this reflex is also mediated by the vagus nerve. Next, finally, you have to write an applied physiology. And the main applied physiology you can write in this case is adynamic ileus. That is, decrease in the motility of the intestine as a result of intestinal trauma of peritonitis. So that is about the movements of the small intestine. Thank you.